Hello, my name is Gabrielle Glantz, and this is my first article critique. I chose an article called Mindfulness-Based Interventions, an Overall Review by Zhang, Li, Mack, Ho, and Wong. The authors review evidence from studies showing that mindfulness-based interventions can enhance mental health, emotional resistance, and then self-awareness in healthcare and educational settings. So their hypothesis was, can mindfulness interventions improve mental and emotional health in healthcare and educational settings? The way that they conducted this study was they did a literature review of clinical trials, observational studies, and meta-analysis on mindfulness to give a balanced view of current applications. So throughout the article, they list out different settings like educational settings, elementary settings. They list out different possibilities of diseases that patients could possibly have. So chronic pain, diabetes, and read about the effects of mindfulness during those trials. The overall gist of the article still needed additional research. Every element that they went over, whether it was diabetes, chronic pain, depression and anxiety, all of the aspects of the article needed additional analysis and additional data. But I think still the major key findings were very valuable. So one of the major key findings, they mentioned that in this article, MBI has positive effects on mental health. So reducing anxiety, better emotional regulation, and then stress reduction. They give an example that it could help nurses with burnout. So allowing them to manage their stress, giving them more compassion for their patients. And then from a patient aspect, it could better their quality of care. They also noted that MBI should be implemented into healthcare training programs and educational programs. This could give our healthcare providers an ability to manage their stress and then also not cause them to have compassion fatigue. So being able to have better stamina when interacting with their patients, if it was implemented into training programs. Some of the strengths of this article, the authors really took the time to evaluate where MBI could be implemented into healthcare. So through this article, they showed that it is very versatile and can be implemented in different elements such as diabetes, chronic illness, patients in recovery, showing that that MBIs could be, if anything, stress reduction for the caregiver and for the patient. Some of the weaknesses and limitations of this article, they did base their studies solely on existing studies. So some of them didn't have randomized control groups. Some of them didn't have really large sample sizes. Throughout the article, they said that MBI could help with stress reduction, but that statistic came from a very, very small sample size. So I feel like it could jeopardize the reliability of this article. But overall, they did a great job in identifying great areas that MBI can be implemented into for stress reduction for nurses that are coming up on feeling burnt out in their roles. So they did a great job doing that. I really like this article, and it resonated with me a lot because at one point in time, right after I graduated college, I was responsible for being the caregiver for my dad. And I do feel like throughout that journey, I had to be very mindful of not just how burnt out I was feeling with trying to help him with his chronic illness, but I also had to be mindful that he was the one that was going through this experience. So I needed to give him grace, give him patience, and allow him time to adjust to his new norm. So this article really resonated with me and showed the importance of me needing to take the time that I need in order to provide better care for my dad. And then for also it could have helped him before he passed away, of just being mindful of, his own health and not just being so honed in on what he was going through. Overall, well, in conclusion, I thought that this article and the authors did a great job at evaluating if MBI could enhance emotional and mental health for healthcare providers, patients, and essentially everyday people. I think that these studies need to be studied more. I think there should be more research with implementing these tools in educational programs, training programs, as the authors, stated. I think if we took the time to do additional research, then these could be tools that we could be implementing at an elementary school or primary school level that will give people the tools to be able to self-regulate, be mindful of the day-to-day circumstances that life puts us in. So I think the authors did a great job, and there should be additional research on this topic. But that's my review.